Welcome back, guys. It's Dr. Somji.
And it's Dr. Solomon.
Today we're going to talk about the top questions that we always get asked about hair transplants. The first question is, when will I see results?
So when will you see results? You will see results after hair transplant, usually within the first 1 to 2 months, but the hair growth cycle actually takes about 18 months.
Yeah.
So we always tell our patients that once they have a hair transplant, having gone through the shedding phase, so you will lose some hair that you've just had transplanted in the first few weeks. And then over the next 12 to 18 months, that hair will start to grow back, and it will grow back thicker and stronger. So at the 18-month stage is when you will see what we consider to be the final result from that transplant.
Yeah, so like what we write in our aftercare is very simple. I say 0 months, 0. 3 months, 20% of the result. 6 months, 80% of the hair has grown out, but you're only getting 50% of the result because the hair is not as thick. And then 12 to 15 months, up to 18 months is when you get 100% result. Right, next question. Is there any pre-care treatments I must do?
Yeah, generally, if you're having a hair transplant, it's imperative that you prepare the area. You actually start medical treatment of the area. We don't jump straight to a hair transplant. Hair transplant we consider to be the final stage of hair regeneration. So it's a combination of topical creams, lotions, medical therapy such as oral medication and injectables, all of which we've covered in other videos. But in summary, we generally prepare the scalp with PRP injections, in some cases oral medication with anti-testosterone medication, and with creams to stop further hair loss. That's the most important.
So like the tonics, so like minoxidil is a really famous one that helps just improve the vascularity, so the blood circulation. And sometimes, we both like this actually, because we actually get people to do the Keravive hair facial, which is the version of the hydrofacial that you guys might know, but it cleanses the scalp beforehand, and you can infuse amino acids that help with scalp health. And it actually makes the surgery a lot better because everyone's got dry scalp to some degree, especially in the UK, because of the water is a bit hard. And it really does prepare the scalp, and I find it a lot easier when we do it, when patients have had it before. Next question. Is there any aftercare treatments that you must do?
After hair transplant, as with the preparation beforehand, it's important that you're stopping further hair loss primarily. So the aftercare focuses on stopping hair loss and increasing the thickness of the hairs that you've just transplanted. So actually it's very similar to the preparation as well. So you're going to continue to encourage growth factors in the area by injecting PRP, for example. There are new types of stem cell injections, which we'll cover in other videos. And in the event of oral medication to stop further hair loss, we normally encourage it. We normally continue that medication, particularly in men and in some women as well.
So I think that through the years this has changed. Like 10 years ago, I just used to send patient out and say, continue your minoxidil, continue your finasteride. Now people, not as many people have finasteride, and some people don't like using minoxidil sometimes because it kind of leaves a residue. Personally, obviously I take finasteride, and I've taken it after my surgery 6 years ago, and so have you. But like the other day, we did PRP, so you can do PRP quarterly afterwards. One thing that we do with the surgery that's fantastic to help with the hair loss in general and maintenance is the Regenera treatment, which is the stem cell treatment, and that can be done like once every 12 to 18 months as maintenance for your hair transplant, and that's really good. And then the hair facials, like we talked about, scalp health, separate to hair loss, scalp health is really important.
So in fact, the preparation before the hair transplant continues in the aftercare.
Everything continues, and you just want to maintain it. So this is the next one that I guess we get asked all the time. Well, friends and family as well. So should I go to Turkey for a hair transplant?
Okay, I guess I'll let you answer that, and I'll give you my answer.
Okay, I'll answer it. Now look, I think that I see this online all the time where surgeons in the UK, surgeons in the US are like, don't go to Turkey, and surgeons in Turkey is like, UK no good. Like there is no such thing. You cannot say that one surgeon in Turkey is good just because he's Turkish, and you can't say that he's bad just because he's Turkish, because that's completely wrong. Everyone's individual. I know some very good surgeons in Turkey, and I think that shouldn't be a decision. Where you're having a surgery should not make a decision. It's the surgeon's experience, that's one thing. their results. So looking close detail in terms of the hairlines that they create. Their team, how long have their team been doing it? So my nurses have all been doing it for more than 10 years. So I know that they're very experienced. And crucially, yes, sometimes the price you pay can have an effect in terms of the effect that you have. Because if a surgeon's able to charge a little bit more and they're still getting patients, it's because they've got good results. So looking at those reviews too. Sometimes reviews are a little bit misleading. I've seen on some websites that unfortunately people kind of like bribe people to leave reviews, but I think they're just choosing and showing surgeons, look, what are the patients that you've seen in the last few weeks that have come back? And let's scroll through your results. And that will tell you a good idea. And if the surgeon's happy to share that, then they've got nothing to hide. The other thing is that price. Look, there are some surgeons in Turkey that charge more than we do, okay? But that's because they feel that they're good and they've got a good backing. The main thing that's a driver for your choice of where you have a hair transplant is, yes, those reviews. In the UK, we've got a bit higher regulation in terms of safety of the surgery. We have the CQC, which is the Care Quality Commission, that check all of our outcomes. They audit all of our behaviors and make sure our cleanliness and all these things that should be in place are in place. That is there in Turkey too, in terms of the health authorities that they have, but it's a little bit more stricter, I would say, in the Care Quality Commission in the UK. But one big thing is who's doing your transplant, because there's too many places, not only in Turkey, but also in the UK, where technicians, people with no medical experience, are actually performing the extractions. So they're incisions that remove the follicles. And that is not right. So you'll see reviews. Surgeon came in, marked the hairline, maybe did a few bits in the hairline, but then the actual excision process, taking out the grafts, is done by other people that are not even nurses. It's absolutely normal, and it's in the hair transplant industry for once you've made those incisions where the hair transplant goes, to put the follicles in, and that's what the assistants do, and that's what they should be doing, just handling follicles and just placing them into the pre-made slots. If that's done, that's absolutely fine and you're quite safe. But anything else, you're risky.
Yeah. And predominantly the reason people do travel to Turkey for hair transplants is because of cost. And the main reason the cost is less is because the overheads are less.
Yeah.
Products and
we're sitting in Knightsbridge at the moment.
Everything is about 4 to 5 times more expensive here.
Yeah.
The currency is weak over there, so it favors the individual financially. And in the end, the surgeon and the technique is what matters.
Absolutely. Now look, hair transplants, you need to review the process at 2 weeks, 3 months, 6 months, 12 months. So look, we call people, that's our normal review period. So we call people back, we monitor it. So look, if you want to be monitoring your hair, then that's one of the things as well. It's weighing up the decision. Like it's like deciding what car to buy. You can buy a car that's like £5,000 or whatever, $5,000, and up to got hundreds of thousands. But it's what is the value you place on it, and it's what's important for you, and that's the most important thing. And a relationship with a surgeon. You've got to have a good relationship with a guy because
it's ongoing care.
It's ongoing. Like you might need another hair transplant soon.